and they're asking you the diagnosis in this patient. Yeah, so let's read the question properly. Thoda. Okay. Laboratory tests reveal undetectable serum levels of all immunoglobulin isotypes, right? And reduced B cell count, right? So last two lines में पूरा question पता चल जाता है तुमको. So when you see all immunoglobulin isotypes are decreased, you immediately think of Bruton, right? That's like the highest yield immunodeficiency. That Bruton, SCID, and DiGeorge. Yeah, these three are super high yield for exams. इतना ये तो आना ही चाहिए तुमको. So the moment you think of all immunoisotypes decreased, think of Bruton. Okay, but don't stop there. Okay, also look at the B cell count. And B cell count is important here to differentiate between common variable and Bruton. Okay, so look here on this slide. Okay, Bruton क्या होता है? There's a defect in BTK gene. Okay, Bruton's tyrosine kinase gene. Okay, क्या होता है उससे? There is no B cell maturation. Okay, there is no B cell maturation from pre-B cells. Okay, इसका मतलब properly B cell बन ही नहीं रहे. इसका मतलब there is a reduced B cell count. And if if B cells are not being formed properly, all immunoglobulin classes are decreased. That makes sense, right? But the important thing here is that decreased B cell count. Okay, याद रखना है. ठीक है, and because B cell maturation नहीं हो रहा है, तो differentiation into different classes will also not happen, right? And since that is not happening, or the secondary lymphoid organs, that's tonsils, lymph nodes, they're also as decreased in size because unka maturation differentiation happens in these lymphoid organs, right? So that's why you will have absent tonsils, lymph nodes. Okay. Yeah. Okay. Now, common variable immunodeficiency. ठीक है, इसमें क्या होता है ना, उसमें there is no B cell differentiation into plasma cell. ठीक है, अभी plasma cell are the cells that make your immunoglobulins, right? So if B cell differentiation into plasma cell is not happening, then all immunoglobulin classes will be decreased. But B cell count will be normal. समझा ना? Differentiation नहीं हो रहा है into plasma cell. But B cell तो normal है. They're just not differentiating into plasma cells. Right, and because plasma cells नहीं form हो रहे, इसकी वजह से there is decreased immunoglobulins. Right. Okay. So also check this out. Okay. Infections and sinopulmonary and GI infections after 6 months. Okay, remember this. After 6 months. Why? Because maternally acquired immunoglobulins होते हैं, they decrease after 6 months. ठीक है? Yeah. And how do you treat these patients? Treatment is with immunoglobulin replacement therapy and antibiotics for the infections. Pretty straightforward. Okay. Now look at this table here. This will summarize all the findings of different immunodeficiency syndromes. Okay, abhi we are discussing X-linked A-gamma globulinemia, which is basically Bruton's only. ठीक है, उसमें B cell count is decreased and all immunoglobulin classes levels are decreased. ठीक है, while in common variable immunodeficiency, B cell count is normal, everything else is decreased. ठीक है. CD40 ligand deficiency में there is increased IgM and everything else is decreased because there is no class switching.
Thanks for watching. Please give a thumbs up and subscribe for more.